Oftentimes, the first indication of carpal tunnel syndrome is numbness and tingling at night. People will oftentimes wake up and have to shake out their hands. So one of the most common conditions I treat is carpal tunnel syndrome. I'm sure you've all heard about it. And basically what carpal tunnel syndrome is compression of the median nerve as it travels through the carpal tunnel. The carpal tunnel is a true tunnel. It goes right through the wrist, and as the nerve travels through the tunnel, then it exits the tunnel, it goes out to all the fingers of the hand. The median nerve gives sensation to the thumb, the index, the middle, and half of the ring finger. And so the most common complaints within carpal tunnel syndrome are numbness and tingling on the thumb side of the hand and on the palm side of the hand. Oftentimes, the first indication of carpal tunnel syndrome is numbness and tingling at night. People will oftentimes wake up and have to shake out their hands and just can't get a good night of sleep because their hands are bothering them. Oftentimes as well, they'll wake up in the morning and their hands will feel stiff and achy. And again, that can be a sign of carpal tunnel syndrome. Really common in people who do repetitive type work, such as typing on a computer or repetitive type manual labor. That all causes a swelling within the carpal tunnel and can cause compression of the median nerve, which can cause these symptoms. Other conditions that can also be associated with carpal tunnel syndrome are diabetes, rheumatoid arthritis, and other systemic inflammatory conditions. And finally, traumatic events such as a broken wrist can also cause more pressure on the median nerve in the carpal tunnel, and that can be a cause of an acute carpal tunnel syndrome due to trauma. If you're developing not only numbness and tingling, but you're feeling weakness in your hands, or sometimes in really advanced cases of carpal tunnel syndrome, you can get atrophy, where if you look at your hands, you'll start noticing that this part of the hand, called the thenar aspect of the hand, will be flattened. And that's really when we, unfortunately, don't want to see people, because that's really advanced stage carpal tunnel syndrome. We want to see you way before that so we can prevent advanced carpal tunnel syndrome with muscle atrophy, because unfortunately, once you have atrophy, that muscle doesn't really recover. So certainly if you're experiencing symptoms of numbness and tingling on the thumb side of the hand, weakness of your hands, you're finding that you're dropping things, or simply pain that's been going on for a couple of weeks, you should probably have your hands evaluated. There are lots of non-operative things we can do to try and decrease your symptoms and potentially put off having surgery, including simple things like wearing a brace at night. Sometimes just taking an anti-inflammatory medication before going to bed can be helpful. As well, there are some physical therapy exercises that people can do that will sometimes help with their symptoms. And as well, in the office, sometimes we'll do steroid injections into the carpal tunnel. And again, we're just trying to relieve the inflammation and the pressures on the median nerve within the carpal tunnel. Ultimately, if non-surgical treatment fails to provide relief of your symptoms, then we have a discussion about surgical options. And my preferred treatment for carpal tunnel syndrome is an endoscopic carpal tunnel release. Studies have demonstrated that doing an endoscopic release, which is a minimally invasive technique where we use a camera to find the nerve and move it out of the way while inside your carpal tunnel, where we can release it through a really small incision. Those studies demonstrate that you can get back to work quicker, you have less pain and better grip strength in the recovery process. By doing that, we can get you back to doing the things that you like to do at a much quicker rate than with the traditional open carpal tunnel surgical approach. My initial training during residency for carpal tunnel syndrome was to do a formal open approach. Many physicians back then were still doing an extended carpal tunnel approach, where the incision not only was in the palm of the hand, came back proximally across the wrist crease. And then over time, the incisions got smaller, so they just stayed in the palm of the hand. And then during fellowship, we started doing endoscopic carpal tunnel releases, where instead of doing an incision in the palm of the hand, which can be painful, we now put the incision in the wrist crease. We hide it in the wrist crease, so once the incision is healed, you basically can't even see where we did the surgery. And then instead of cutting from the outside in, we do all our work from the inside with the endoscope. That has progressed now where not only we can treat carpal tunnel syndrome that way, but there's a similar condition called cubital tunnel syndrome. And I also do an endoscopic cubital tunnel decompression as well. Cubital tunnel syndrome is compression of the ulnar nerve at the elbow over here, kind of the funny bone nerve. And cubital tunnel syndrome can cause numbness and tingling and pain on the pinky side of the hand. So similar to carpal tunnel syndrome in that they're both nerve compressions, but carpal tunnel syndrome is compression of the median nerve at the wrist, and cubital tunnel syndrome is compression of the ulnar nerve at the elbow. The techniques, though, are very similar in both the endoscopic approaches to the wrist or the elbow. And the goal, once again, is relief of your symptoms and faster return to work and play with either approach.